Good evening. On behalf of the Student Academy of Doctors of Audiology, I would like to welcome you to today's Student Practice Management webinar, Licensure and Certification. My name is Andrew Abernathy. I am pleased to serve as today's course coordinator. I have just a few housekeeping reminders before we begin. If you have any technical challenges during the session, please use the chat feature to make me aware, and I will be glad to assist you. Please type your questions into the question queue, and they will be addressed by the presenter at the end of the presentation. Today's presentation is being recorded and will be available for online viewing next week. I'm excited for the opportunity to welcome AUD students from programs across the country to this session on licensure and certification. It is also my distinct pleasure to introduce today's course leader, Dr. Kim Cabot. Dr. Cabot was a clinical audiologist and preceptor at the Ohio State University and Northwestern University. Since 2001, Dr. Cabot has operated her own audiology consulting firm, Audiology Resources. Audiology Resources provides comprehensive operational compliance and reimbursement consulting services to hearing healthcare providers. She is a past president of the Academy of Doctors of Audiology, serves as the chair of the State of Illinois Speech Pathology and Audiology Licensure Board, serves on the Audiology Quality Consortium, and serves on committees through ADA and ASHA. Dr. Cabot is also an adjunct lecturer at Northwestern University, a visiting lecturer at Western Michigan University, and the executive director of Think Audiology Initiative. Please welcome Dr. Kim Cabot.
Hi, thank you. Thank you, Andrew, and thanks to SADA for inviting me to present tonight. So tonight, I'm going to talk to you a little bit about licensure and certification. And this is a talk that I give to my own AUD students every year at Northwestern, so something that I have a lot of background and experience in. So thanks for inviting me. So first, let's talk a little bit about licensure. Licensure is governed by the individual states or territories. So there's the 9 territories, there's the 50 states, and each state kind of has its own distinct licensure. Your licensure is going to dictate your scope of practice, what the requirements are, the minimum requirements for licensure, ethical practice and code of conduct, and what your continuing education is. You must be licensed as an audiologist and potentially in some states also as a hearing aid dispenser in order to see or provide telehealth to patients. The VA is an exception. So when you go to work at the VA as an employee, you have to be licensed in a state, not necessarily the state in which you're practicing. When you're licensed outside the VA system, you need to be licensed in the state in which your patients reside. So if you want to work in telehealth, but your patients are residing across the border in another state, you'll need to be licensed in that other state as well. And in some states, you also, again, have to be licensed as a dispenser. It's important for audiologists to learn the rules, regulations, and requirements for licensure in the state in which they want to practice. And even if you're not, a typical rule of thumb is that even if you aren't beholden to the hearing aid dealer's license, you still have to follow those licensure rules in the act or dispensing of hearing aids. And again, in anything in this space, ignorance is not a defense. So not knowing is not a defense if something bad were to happen. So let's now move to, we're going to come back to licensure, but we're going to now talk about certification. Licensure dictates your ability to practice. Certification does not. It's an extra credential. We have 2 certifying bodies in the United States for audiologists. One is the American Speech Language Hearing Association, or ASHA. You have the link here to their certification requirements. In order to be ASHA certified, you have to have a passing score on the Praxis. Again, one thing I want to say here, as I go through these requirements, you're going to notice that they're oftentimes redundant to graduation. So typically they are not unique. They're not really unique at all to anything more than you have to have for graduation from your AUD program. So you have to pass a Praxis exam. You have to show or have shown equivalency of an AUD degree earned from a Council of Accreditation on an Audiology accredited program. You have to have clinical supervision from someone who has their ASHA Cs. That you have to have 9 months of practice experience post certification to be a supervisor, and a preceptor has to have been out 9 months and 2 hours of professional development in the area of supervision for their supervision to count towards your certification. The accreditation body no longer prescribes a specific number of hours of supervised clinical practicum. You and your program is going to determine what those hour requirements are. So that 1862 is no longer required. It's all about competencies. So technically, if your program graduates you, you will have met the supervised clinical experience requirements of ASHA. Again, though, ASHA requires that clinical experience needs to be supervised by someone with their C's. And if you don't get that supervision as part of your AUD program, you can get it post-graduation from your AUD program. So if you really love this externship, because again, another rule of thumb is you're going to get the hours for or the competencies of certification typically around your externship. So if you love this experience, but the person doesn't have their C's, you can always get your C's post-graduation. You just have to have some experience supervised by someone who has their C's. But it can, again, happen post-graduation. Applicants are encouraged to include interprofessional education and interprofessional practice in their clinical experience. That's something that's important in the new ASHA certification requirements, that you have some semblance of interprofessional practice under your belt as part of your application. If you didn't complete your entire supervised experience under an ASHA certified supervisor, you can make that remainder post-graduation. The knowledge and skills for certification have been updated and reordered in accordance to their practice analyst survey results. That's why you're going to see a lot of people in programs now talk about the CASA competencies. That's part of the ASHA certification requirements. And beginning in the 2020 to 2022 certification maintenance interval, you're going to have earned one of your 30 required maintenance hours every year in ethics. ASHA costs, if you are initial a member, then your conversion to ASHA certification is $286. If you are not an initial member, your conversion is $461 if you're a recent graduate and it's within the last year. And once that first year is up, ASHA membership and certification is $511 every year. You can also be certified by the American Board of Audiology, which is under the umbrella of the American Academy of Audiology. You can see this link as well. AAA membership is not required to be ABA certified. The requirements of ABA certification are an AUD in audiology from a regionally accredited university, an audiology license, so they want you to have your license first, which ASHA does not have the requirement, and you need 2,000 hours of mentored professional practice of clinical practicum. So they do have an hour requirement still, and those hours can be supervised by any licensed audiologist. The cost for recent graduates for a AAA member is $110 if you complete this within the first 6 months of graduation. After that, if you're not a recent graduate, it's $175 if you're a AAA member, or $345 if you're a non-member. And then your annual renewal fee is $75 if you're a AAA member, or $200 if you're a AAA non-member. The American Board of Audiology, again, to maintain your certificate, you need 20 hours of continuing education, including a minimum of 5 hours in Tier 1, that's 3 hours or more courses, and 1 hour in professional ethics. You have to adhere to their code of ethics and pay the required fees, and signed an attestation statement that you're going to practice within the ABA Code of Ethics and that you meet the CE requirements for recertification. Let's talk, though, a little bit about the truth around certification. Programs in audiology, all the audiology programs are accredited. What makes them an accredited program is an accreditation. the one accreditation that all the programs have is from the Council of Academic Accreditation in Audiology, Speech Language Pathology, or CAA. Here's a link. It is affiliated with ASHA. This agency, again, really accredits all the AUD programs. It establishes curriculum standards, but again, you do not have to, nowhere in these accreditation standards does it say that you have to have, that your end goal has to be your ASHA Cs in order to have an accredited program. There's no mention of that in the standards, that the outcome of your AUD program has to be the ASHA Cs. That's a decision that you all get to make individually as part of your AUD program. But the fact that all the programs are accredited is really what still helps tie the Cs to academic institutions. There's also accreditation through ACAE, or the Accreditation Commission for Audiology Education. It's affiliated with the American Academy of Audiology. It also establishes curriculum standards, but of about the 80 programs that now exist, only 5 programs are ACAE accredited. They're all CAA accredited, but only 5 are additionally CAA accredited. I mean, ACAE accredited, sorry. Okay, now we're going to go back to licensure. Licensure is what gives you your ability to practice. It's not certification. There is no state in the United States that has no path to licensure that doesn't that requires you. Every state has a path to licensure without certification. Every state, they can't force you to be certified to be licensed. Are there paths in some states that are easier if you are certified by either ASHA or ABA? Yes, there are easier paths, but is there a path to licensure in every state that is not certification? There is also a path to licensure without certification. I cannot stress that enough. I'll use my state of Illinois as example. We don't even, unless you're a foreign applicant, which there's no foreign AUD programs, unless you're a foreign applicant, there is no path. There's certification isn't mentioned at all in the audiology aspect of licensure. So licensure, again, is certification is optional because licensure gives you the ability to practice. Licensure, again, varies state by state. And again, some of you may also have, in some states like Kentucky, you have to have an audiology license and a hearing aid dispensing license. That depends on the state. There's some great links here, and I'm going to give a big shout out to ASHA has a state-by-state guide that will really walk you through all the requirements of what you need for licensure in each state. So something that students have to think about is a temporary or provisional license. So if you are going to go to do an externship in a state like Florida or in a state like California, you need to have a provisional or a temporary license, however they term that. And that license is what covers you essentially for your externship year. Every state does not have a temporary provisional license. My state of Illinois does not have that license, but some states do. And so you need to be aware that you might have to go through some licensure hoops before you begin your externship year. So let's say you completed your externship. And this is one thing that I always have to really stress to all my students. You're going to, I'm doing air quotes, but you can't see me, graduate. You're going to, well, in a non-COVID year, you're going to have a graduation ceremony. You might have a white coat. You might have a robe ceremony. You're going to have a ceremony. That doesn't mean that your program is over. That just means that you had the ceremony. You have to wait until your program is over. Typically, from the last day of your last final of your AUD program, it's going to take most institutions about 2 weeks to get your final transcript that shows that you are graduated. You can't submit a license in the vast majority of states without that approval or your diploma, which usually comes even later, but that letter from your program typically takes a couple of weeks post-graduation. Then you're going to submit for your initial license. And again, certification isn't required, but it can make it easier. But let's own certification too. You can't submit an application for certification until you have this approval from your program or your academic institution that shows you've graduated. So if you're going through a process that you're going to get certification before licensure, you're going to have to get all of the paperwork, a copy of your praxis scores, unless you sent them to ASHA. You're going to have to get that graduation transcript. It's going to have to go to ASHA or AAA in order to get the certification done. But remember, what's going to need to go to ASHA because AAA requires a license. But for you to get that going, if you go that path first, it's just adding again on to time. Whereas if you went straight and did your license, it's, you're not going to have that little, that step to get certified first. So then once your application is submitted, some states do not let you practice at all until your license is approved and granted. Some states, again, like my state, you can practice 60 days from the date they tell you you have a completed license. You could start practicing then. You have 60 days until that allows them to grant your license in that window. You can't get credentialed with an insurance company. You can't get credentialed with Medicare. There's things you can't do, but you could practice. Otherwise, you can't practice while this license, technically you can't practice because you're an unlicensed audiologist. You're not a student anymore. You're not governed under your institution's malpractice. You are not a student of that institution and you're not licensed. So you can't see patients even under someone's supervision. You're unlicensed. So you're going to have this window between graduation and seeing your first patients that you're not going to be able, again, to get a job and like graduate on a Friday and and start your job on Monday. That's not how it works. You're typically going to have a 2 to 8 week window. This is what I recommend to all my students. You've gone through a lot of school. You've gone through 13 years of primary and secondary. You've gone through your bachelor's degree. You've gone through your AUD degree. This will be the first time in your life when you really have nothing to do, no real responsibilities. Take a break because after you start your first job, now you're on the hamster wheel of being employed, and it's hard. You're going to get 2 weeks of vacation, 3 weeks of vacation for several years. So enjoy, take a break, refresh yourself as much as you can, and get your license in as soon as you can. Have the license ready to go out the door the way it's supposed to be sent. And be waiting for that notification for your institution so that you can send things off. Because your initial license, you may have age requirements. They might do background checks. You might have ethics requirements. You might have to go through some ethics training. You need a diploma in some format, some shows that you graduated from an AUD program. You need, again, your praxis score. You may, again, if you're not going through the certification process, some states may require you to document and have someone sign off on your clinical education that you've completed an externship, what that looks like, because most states have, not all, but most states have requirements of number of hours and length of your externship. That's important that you meet and that you know that you're aware of, because again, your institution's going to need to sign off or document that. And again, the number of hours required for licensure and the length of your externship experience is going to vary state by state. Like in Illinois, it's 1,500 hours and 9 full-time equivalent months of of an externship. California is 11 months. It just depends on the state, but especially in the world of COVID, those of you out there that are in your second, third year or about to go off an extern or in your externship, you should be very aware of what constitutes a completed externship in the state in which you want to apply for licensure. Your state license, not a national association, it's your state license that dictates your scope of practice. And it's very important that you know what that scope is. That if you are practicing outside your scope of practice, then your malpractice insurance is null and void. So you want to be very aware of what the scope of practice is in the state you want to practice, because AAA and ASHA don't dictate your scope of practice. Payers don't dictate your scope of practice. Medicare, they don't cover treatment. That doesn't mean you can't provide treatment. They just don't cover it. Payers don't have to cover everything in your scope of practice. And you don't get to interpret it alone. And this is the example I always give my students. It doesn't say that you can't do surgery, but you can't do surgery. So if your licensure law doesn't say something, doesn't mean you can do it. It means that you need an interpretation from the licensure law, from the board. So if there's something that's unclear, you need to write to the licensure board and have them explain to you whether you can or cannot do it. So don't just assume because people are doing it that you can, because I'll tell you a little story. Several years ago, there was a state that didn't have cerumen removal in their licensure act. And so they went to add it to their licensure act. And people asked about training. Oh, are you trained in this? And they were like, well, we've been doing it for years. Well, the problem was they had to do a cease and desist to every audiologist in that state to say, we're not licensed to do this. We're not allowed to do this. And again, until it could be added to the act. So just because, again, you were trained in it, interoperative monitoring is a great example. Vestibular rehab, cognition, basic health screenings. Those are things you might have been trained in, but that doesn't mean in your state it's in your licensure act in order to be able to perform them. It's super important that you're aware also of all the ethical and legal requirements of both the audiology and the hearing aid dispensing licensure boards and acts, and those scope of practice limitations. And as I said before, professional liability coverage is typically null and void if it's found that you're practicing outside your scope of practice. Some things that you need to look for in licensure. Does your license allow for vestibular assessment and management? There's actually a licensure law in this country that doesn't have the word vestibular or balance anywhere in it. So can they technically provide this? I don't know. Cerumen removal, can't provide cerumen removal in every state. And in some states, there are rules about, yes, you can provide it, but when and how. Interoperative monitoring, evaluation and management services or codes. Those are the codes that physicians use to represent office visits. Can you provide evaluation management? Because the code set says you can't use this code set to bill to a payer or to a patient unless it's allowed by your scope. So if it's not allowed by your scope, then you can't even bill a patient privately for it. So it's important to know, can you provide the words evaluation or evaluate and management or manage in your scope of practice? Basic health screenings like depression screenings, falls risk assessments, cognitive screenings, speech language screenings, postural blood pressure, are those things that you can within your state license provide. Can you provide cognitive screening and treatment? Can you provide telehealth? There's a lot of states out there that can't provide telehealth. Even in COVID, there's still about 5 states that even in COVID can't provide telehealth. So what does your state say about telehealth? What are the rules around it? Because again, there's been a lot of exceptions made for COVID for telehealth, but again, those exceptions will expire. Some states didn't get exceptions. It's, again, you have to know where your state lands on this. And use the term doctor without doctor of audiology. When you write your name, when I write my name in my state, because I have this requirement in my licensure, it should say Kim Cavett, comma AUD, and underneath it or immediately following it, it should say Doctor of Audiology. So if it's on a name badge, if my name badge says Dr. Kim Cavett, and please, no, you should never write Dr. Kim Cavett AUD, that's redundant. You never see Dr. John Smith MD. But if my name badge said Dr. Kim Cavett, it would have to say Doctor of Audiology underneath in my state. If it said Kim Cavett AUD, it should say Doctor of Audiology. It wouldn't have to in that case because I didn't call myself a doctor, but I could write underneath it Doctor of Audiology. But anytime I put the DR in front of my name, I have to have in Illinois Doctor of Audiology immediately following. Where does your state land on this type of an issue? It's important. It's important to know. Does your state have mandatory reporting of child abuse, elder abuse, fraudulent or unethical practice, or the supporting of unlawful practice? The last one, supporting of unlawful practice, is you knew someone was doing something unlawful in the practice you work in and you didn't turn them in. So those can be grounds that you could have your license disciplined. So you do need to know about child abuse reporting, super common, elder abuse reporting getting more and more common. And again, fraudulent ethical practice is in codes of conduct or practice policies and very common in licensure. Audiology assistants, technicians, support staff. So first of all, an audiology assistant or a technician can't always perform tests. An audiology assistant or technician or support staff can't perform testing on a Medicare beneficiary under the supervision of an audiologist and legitimately receive payment. Let's first talk about audiology assistants. Audiology assistants, if there is no mention of them in licensure, again, they can't exist. So you shouldn't, that would be the practice of audiology or practice of hearing aid dispensing without a license. So if your state doesn't have provisions for audiology assistants, then they can't be seeing patients, can't be touching patients' products or working with hearing aids or anything of that nature, because that's the practice without a license. If in your state there is provisions for it, you just need to follow the rules of provisions, whether it's supervision, how many assistants you can have work for you, what their scope of practice can be, all of that, if licensure or registration exists, will be outlined. Technicians are someone who performs a procedure, but they don't interpret it. Technicians can typically only work under the supervision of a physician. And again, support staff, if you're letting support staff do change battery doors, change receivers, do pure tone air, whatever it is you have them do, you could be supporting the unlicensed practice of audiology or hearing aid dispensing in your state. So you want to know what those provisions are. The work of a technician can't be billed, or an audiology assistant can't be billed incident to or underneath an audiologist. Again, sometimes under a physician. The only time a technician can work or if audiology assistant can work under the supervision of a physician is for OAEs, ABR, the vestibular family of codes. That's it. That's the only thing that a technician can perform under the supervision of a physician. Otherwise, again, it's going to be whatever your Licensure Act says about the use of assistants. Audiology assistants can oftentimes obtain a national provider identifier, although its use depends on the level of independence allowed in state law and the managed care agreements. When it comes to assistants and technicians, you need to be super aware of their scope of practice issues, what they can and can't perform, the limitations on that. What are the supervision requirements? what kind of supervision? Is it personal that you have to be in the room with them? Is it direct that you just have to be in the office suite, like you can't be on vacation, you can't be off that afternoon, you have to be readily available to engage in the patient's care? Or is it general where you could literally be gone and you're just signing off on things? That's going to really vary state by state, because again, let's go back. Lack of licensure doesn't mean that you can have these individuals working for you and working in the capacity of patient care. So the FDA requirements still exist in most state dispensing laws. While the FDA in December of 2016 said, we are not going to police the medical clearance and medical waiver, they did not rescind that requirement. So when they didn't rescind it, that just meant that they're not policing it, but states, because it wasn't rescinded, still had to keep it within their own dispensing laws. Here are the links to the FDA requirements as they exist today. Everyone believes that these requirements will markedly change when the provisions and the implementation of the OTC Act happens later this fall, but this is where they are today. The FDA requirements are that booklet that comes with every hearing aid, the user brochure, is always given to the patient at every fitting. And at every fitting, you need a medical clearance or a medical waiver. It's not once per lifetime, it's every fitting. So a medical clearance is required for anyone 0 to 17 years of age. You have to have a medical clearance for every fitting in every state. That we do not believe will change at all with OTC. If over 18 years of age, you can either have a medical clearance or a medical waiver. And it needs to, again, these forms, the medical clearance and medical waiver, need to be in that FDA language that's really outlined in these links that I provided above. Here is what they said in 2017, that essentially they were not going to police it. But again, it's still a requirement in most state laws. I know of no state that rescinded it because they said they couldn't, because the FDA didn't rescind it. They just said they weren't going to enforce it. So a lot of state dispensing laws have language around the FDA referral red flags or the warning signs of ear disease. That's that active drainage within the previous 90 days, history of sudden or rapidly progressive hearing loss, unilateral hearing loss, conductive hearing loss or an ear bone gap, impacted cerumen or a foreign body in the ear, pain or discomfort. That can include otalgia as well. Visibly congenital or traumatic deformity of the ear, cauliflower ear, exotoses, or acute or chronic dizziness. And so when a patient presents with one of these 8 things, it is strongly recommended that the patient have a medical clearance and not sign a waiver. You're all going to be faced with the decision of, would you let a patient sign a waiver if they really needed a clearance? And I'll just walk through. For me, like if I had a patient who had a unilateral hearing loss that they'd already seen a laryngologist over and they've had it for 30 years and it's unchanged, I would let them sign a medical waiver. But if any of these situations are new patients to me or new situations, I would want to have a clearance. I would want to go through that step and refer them to a laryngologist or an otologist to, again, have that medical clearance taken care of. But you're going to be faced with, because technically a clearance is not required, it's recommended. So you're going to get to make that decision, and you're just going to have to make one that you can document and you're comfortable with. Again, just because the FDA said they're not going to enforce the medical waiver or medical clearance requirement for adults, the states have all kept it in place. And so it's, again, important that you're still using medical clearance and medical waiver forms at every fitting until this is all finalized and worked out. Some other things that are governed by the state, medical record retention. So HIPAA, or the Health Insurance Portability and Accountability Act, says that you have to keep medical records for 6 years from the date of the last visit. But states can have medical record retention policies, they typically do, that are even greater than that. So your state is going to govern how long you have to keep records, whether they're paper or electronic. They're also going to govern how much you can charge for access to medical records. Do you have to give it to someone electronically if they request it electronically and you store it electronically? That's all governed by medical record retention laws. I've seen laws that it can be as high as 24 years. Like if you saw a baby at newborn hearing screening, you have to keep those records until they're 24 years old. So that's how long it could be. So you really want to be aware of that, what that exists in state laws. Again, telepractice. Telepractice isn't, again, super important, especially in the COVID world. Some states have, outside of the individual licensure laws of a profession, they will have state, my state, we have a big telehealth bill statute that covers all providers across telehealth. Many have, this is also important in the COVID world, some states in their dispensing law have audiometric test requirements, what constitutes a hearing test to fit a hearing aid. So in some cases, some of the self-assessment tools that are just air conduction won't meet the dispensing requirements of your state. Like my state of Illinois, it's air, bone, SRT, Discrim, MCL, UCL. So again, some of these self-assessment tools are not going to work in order to meet the requirements to dispense a hearing aid in the state. Those are things you're going to have to learn about in licensure. Audiometric test environments. There are some states that require a booth or require that you've done sound measurements. You need to know what those tested environments look like, and hearing aid bills of sale or sales receipts, what that patient takes home. There are states like Michigan doesn't have a requirement of a sales receipt. Neither does Iowa. Some states have, like Illinois, very specific requirements with like font. California, very specific. You want to know what those sales receipts types of requirements are as well. And the final thing I want to bring up, as it essentially kind of parlays into telepractice, is an interstate compact or practice. A compact is when states get together and say, we don't care if your provider is licensed in your state, because we're in a compact with you. They can be licensed in your state, but see a citizen in my state. So there is a compact being worked on by ASHA, AAA, ADA, everyone's kind of endorsed it, but it allows state members of the compact to have that single license in one of the participating states and practice with that single license in other states that are participating in the compact. Right now, there are only 4 states in the compact: Utah, Wyoming, Oklahoma, and West Virginia. Again, so that means that you can have a license in Utah and you can see a patient who's residing in Wyoming or residing in West Virginia. But you can only see within those 4 states because they're the only ones at this point who have signed the compact. There's controversy in some states around the compact because, again, dispensing laws and audiology licensure laws are at their heart consumer protection laws, and there are some states that don't feel like the licensure is as robust or the requirements are as robust in other states, and so they're not like gung-ho about compacts. But again, this is something I wanted to bring up because I think in your generation of practitioner, this is something that's going to be very, very common. And who decides about the compact? It's actually your state licensure board is going to make those compact decisions, but it's also going to be their attorney. Every licensure board has legal counsel that works for the state, and ultimately, while a board could make a suggestion to be in a compact, the state could say no, and kind of vice versa. The state could say yes, and the board could say no. So that's something that you're going to really see get a lot more traction, is this whole compact idea. And finally, I want to close with, I'm going to go back to this slide so we're looking at something. I want to close with, licensure laws are only as good as the audiologists in the state. Nobody is going to come and swoop in and no national association is going to come and swoop in and help you hire lobbyists for you and help you navigate changing your audiology license. That really requires you to be engaged in your state association. That work is done at the state level. So it's really important as you graduate. If someone asks me, what national association should you be a member of? My first response is, you need to be a member of your state association, because they control your ability to practice. That's where you get that ability. It's not AAA, it's not ASHA, it's not ADA, it's that state association. And you need to be engaged and involved in that. I'm going to tell you, as someone who went through in my state of Illinois, every 10 years, our Licensure Act opens up. And so in the last two licensure changes in 2008 and 2018, I was really involved. A bunch of my colleagues, we have a really good process here that has really worked for us. We're very proud. We believe that we have probably the most encompassing largest scope of practice audiology act in the country. But you do that because we had 37 people who stepped up and said, I want to help. We had good membership that we could afford a lobbyist who was very well connected, who could help navigate this process. We had relationship with legislatures. So that is actually you, the audiologist at the state level, who makes it happen. So please support your state associations, engage, because if there's things you want to change, it's going to be you who changes it in your state. It's not going to, again, be some national association. So I don't know where we are in time because I haven't looked. I did leave, perfect. I left some time for questions. I don't know if there's anybody on to ask questions, but if anyone, many of you are ADA members, so the final thing that I will say here is, if you are an ADA member, a SATA member, you have access to me for any questions or comments or concerns. Access to me for coding, billing, insurance, licensure, whatever that is in practice management in that space. It is a value-added benefit of your ADA membership, and you can ask questions at any time. If any of you are watching and you're not SATA members, become a SATA member and you can ask me a number of questions. I can sometimes help in externship stuff because I've done that as well. But if there's anything about licensure or certification, anything I can answer for you, especially as it pertains to the externship or initial application process, please reach out. If you're a SATA member, I'd be happy to help you. So now I'm officially done, Andrew.
Awesome. Thank you, Dr. Cabot, for a great presentation. It looks like we do have one question in the queue.
Awesome.
What are your recommendations for students graduating but not knowing where they will be practicing? Should they get a license in the current state of residence until a job opens up?
That is an awesome question. I love that question. I would get a license where you are. If I want to give you a big if, look at some states that do a little bit of research and find out, in the states that you might want to move to or that are in your consideration list, how do they handle reciprocity? Reciprocity means that you're practiced in one state and you're applying via the license you already have. If the reciprocity is simple and easy and straightforward, absolutely go ahead and get a license where you are right now. Especially, I know this is, I'm going to give you a little tip of the trade. Let's say that you wanted to apply to a state that requires a 12-month externship. But because of COVID, your universities let you off at 10 months and gave you a diploma, because this is the world that we live in. It's not anything against an institution. What were they supposed to do? This is what they did. So you might not meet the requirements because you're going to attest that it was 12 months. So maybe you would get licensed in the state you're in now that you meet the requirements of, and then you use reciprocity to apply. That would be a little kind of tip, but I would probably get a license somewhere, either a state in which you're sitting right now, the state you're originally from, is another good choice, where your family lives, your parents, your boyfriend, your fiance, whatever that is. Just get that license so that you have one, because it will make, because then you can, in a lot of states, you can go practice with a license from another state for a window of time while you're applying. And like, let's use Illinois as an example. It's 60 days if you're a new applicant. It's 120 days if you are practicing with a license from another state. So that's something to think about, please. That's such a good question, and I'm so excited that you thought of that awesome question. I would get a license in a state. And again, let's think about the VA. All you need is a license in a state. So if you're applying to VAs, you're ready, rearing to go without any hiccups. So yeah, I would get a license.
Awesome, and thank you so much for that question. That looks like that is our only question at this time. Just as a reminder, if you're watching this webinar after the fact, if you do have a question, please email them to info@audiologist.org, and we will forward those questions on to Dr. Cabot. If you have any friends or colleagues that were unable to attend the webinar today, please let them know that this session has been recorded. Like I said, we will send out a link to attendees after the recording is posted. Thanks again to Dr. Cabot and for everyone who attended. For more information about future SATA practice tongue-tied. For more information about future SATA practice management webinars and to register, please visit www.audiologist.org/students. Thank
Thank
you
you.
and have a great evening.
Thanks.